Hi, the dear channel member of me, how are you? This channel is recommended for you, so you should participate attentively and don't forget subscribe the channel and like, share, comment the video. In today's video we are gonna teach about view of anatomy. Let us get started. What is anatomy? Anatomy is the study of the structure of the human body and relationship of its part. It is also called morphology, the science of form. An old and proud science that has been a field of serious intellectual investigation for at least 2,300 years. Where did come from the word anatomy? The word anatomy is derived from the Greek term anatome, consisting of two words anatomians up or apart and tomians cutting. Therefore anatomy means to cut apart, divide or dissect. It was the most prestigious biological discipline of the 1800s and is still dynamic. Therefore, anatomy is a branch of science that deals with structure of the body and their relation. If you are preparing for a career in the health sciences, your knowledge of human anatomy is the foundation of your clinical practice. Anatomy is closely related to physiology. Anatomy and physiology are studied in separate courses, but they are truly inseparable because structure supports function. For example, the lens of the eye is transparent and curved. It could not perform its function of focusing light if it were opaque and uncurved. Similarly, the thick, long bones in our legs could not support our weight if they were soft and thin. Anatomy is essential in fields like medicine, biology, and health sciences, as it helps understand how organisms are built and how their bodies work. Who had a contribution for the development of anatomy? The human anatomy was taught in Greece by 1 Hippocrates, 460 to 377 before Christo, B.C., who was regarded as the father of the medicine and a founder of the science of anatomy. 2 Aristotle, 384 to 322 B.C., was the first person to use the term anatome. 3 Galen, a philosopher born in 130 B.C., who used dissection of human and animal bodies. During the Renaissance, artists and anatomists like Leonardo da Vinci, Michelangelo, and Vesalius, 1514 to 1564, began to accurately display and describe the parts of the human body, and thus to revise, amend, and correct many concepts. Dear learner, could you list the several subdivisions of the anatomy? Gross anatomy is the study of body structures that can be examined by the naked eye. Microscopic anatomy is the study of structures that are so small and can be seen only with a microscope. Cells and cell parts, and tissues. A knowledge of microscopic anatomy is important because physiological and disease processes occur at the cellular level. Regional or topographic anatomy is the study of all structures in a single body region, such as the abdomen or head, are examined as a group. Applied anatomy, the practical application of anatomical knowledge to the diagnosis and treatment of diseases. Ultrastructural anatomy, the ultramicroscopic study of structures too small to be seen with a light microscope. Developmental anatomy traces the structural changes that occur in the body throughout the lifespan and the effects of aging. It explores how body structures form, grow, and mature. Embryology is the study of how body structures form and develop before birth. Knowledge of embryology helps you understand the complex Design of the adult human body and helps to explain birth. Defects, which are anatomical abnormalities that occur during embryonic development and are evident after birth. Pathological anatomy deals with the structural changes in cells, tissues, and organs caused by disease. Briefly, it is the study of structural changes caused by diseases. Used primarily for medical diagnosis and scientific research. Radiographic anatomy is the study of internal body structures by means of X-ray studies and other imaging techniques. Comparative anatomy is the study of similarities and differences in the anatomy of different species. It is closely related to evolutionary biology and phylogeny, or the evolution of species. Surface anatomy is the study of shapes and markings called landmarks on the surface of the body that reveal the underlying organs. It also deals with anatomical features that can be studied by sight without dissection. Some have everyday names like the palm of the hand, the sole of the foot, and the nape of the neck. It used to identify the muscles that bulge beneath the skin and weight. Lifters and clinicians use it to locate blood vessels for placing catheters, feeling pulses, and drawing blood. Dear learner, what are the approaches to study anatomy? There are two main approaches to study anatomy. The first one is systemic approach. In systemic approach, all the organs with related functions are studied together. Classification is based on function, structures that have a common function studied together. That means about 11 systems are found in human body. Example: circulatory, respiratory, integumentary, skeletal. The second one is regional approach. It deals with several systems located in a particular region of the body. It also deals with all structures in a single body region, such as the abdomen or head, are examined as a group. Example: limb, that means upper and lower back, abdomen, head, neck. It used mostly in dissection room and useful to physicians and surgeons. Note: regional anatomy focuses on specific external and internal regions of the body and how different systems work together in that region, while systemic anatomy focuses on the anatomy of different organ systems, such as the respiratory or nervous system. Dear learner, do you describe what you think about the levels of structural organization of human body? Well, life processes of the human body are maintained at several levels of structural organization. These include the chemical, cellular, tissue, organ system, and the organism level. The human body has many levels of structural complexity. The first one is chemical level. The chemical level includes all atoms and molecules essential for maintaining life. Major atoms like carbon, hydrogen, oxygen, nitrogen, calcium, potassium, and sodium. And the molecules like proteins, carbohydrates, fats, nucleic acids, DNA, RNA, and vitamins. Atoms unite to form molecules. That means molecules are building blocks of the structures at cellular level. The second one is cellular level. Cells are the smallest living things in the body. Cells are the basic structural and functional unit of an organism. Cells have 2 or 3 principal parts or partition or compartments. Those are plasma membrane or cell membrane, cytoplasm and nucleus. Dear learner, with a great apologize, you should look the organelles deeply on your course material. The third one is tissue level. Tissues are groups of similar cells and the substance surrounding them that usually arise from common ancestor cells and work together to perform a particular function. There are 4 basic types of tissues. These are epithelial tissue, muscle tissue, connective tissue, and nervous tissue. The fourth one is organ level. Organs are structures that are composed of 3 or more different tissues that have specific functions and usually have recognizable shape. The fifth one is system level. A system consists of several related organs that have a common function. Example: digestive system, breakdown of food and absorption. The last one is organismic level, is the result of all of the simpler levels working in union to sustain life. Dear learner, could you define the term cytology, histology, organology, systemic anatomy and gross anatomy with their relationship? My audience, do you feel a happiness with my lecture? If so, like the video. Well, now I am going to teach you about the anatomical position. What is anatomical position? Please try it by pausing the video. Anatomical position is standard, common, visual reference position of a body universally used in anatomical descriptions. It used to describe body parts and their location. It is also the position of reference for anatomical nomenclature. And we can explain as follow. Body stands erect in upright position facing the observer. Feet flat on the floor together / far apart with shoulder level. Head level and the eyes facing directly forward. Arms placed at the sides. The palms of the hands turned forward and the thumbs pointed away from the body. Additionally, the term right and left always refer to those sides belonging to the person or cadaver being viewed, not to the right and left sides of the viewer. What about anatomical terminologies? Anatomical terminologies are terms of position and relation. Most anatomical terms are based on ancient Greek or Latin words. For example, the arm is the brachium and the thigh bone is the femur. Standard directional terms are used by medical personnel and anatomists to explain precisely where one body structure lies in relation to another. Directional terms indicate the relationship of one part of the body to another. Anatomical terminology is less wordy and confusing. Most often used are the paired terms superior or inferior, anterior or ventral, posterior or dorsal, medial or lateral, and superficial or deep. What are the terms of position and relation? 1. Superior means above, or to the upper parts of the body, or towards the head or away from the leg. 2. Inferior means below, or the lower part or away from the head or towards the leg. 3. Cranial, rostral, cephalic means nearer to the head. 4. Caudal means nearer to the tail. 5. Anterior means in front. Towards the front of the body. 6. Posterior means behind, away from the fronts of the body. 7. Ventral means in the direction of the abdomen. 8. Dorsal means in the direction of the back, farther from the origin of the part. 9. Medial means nearer to the midline. 10. Lateral means to the side. 11. Median means at the median plane. 12. Palmar means upper. Towards the origin of the part. 13. Distal means lower, farther from the origin of the part. 14. Palmar means on the side of the palm of the hand. 15. Plantar means on the side of the sole of the foot. 16. Superficial means nearer to the body surface. 17. Means nearer to the center of the body. Now I am going to teach you about the body planes and sections. What are the body planes and sections? Planes are imaginary flat surfaces that are used to divide the body or organs to visualize interior structures. The body is divided by the following planes or imaginary flat surfaces in different sections. A. Sagittal plane. A sagittal plane is a vertical plane that divides the body or an organ into right and left sides. It also divided into two. The first one is mid-sagittal or median plane. It is the plane passes through the midline of the body or organ and divides it into equal right and left sides. The second part is parasagittal plane. It is the sagittal plane does not pass through the midline but instead divides the body or an organ into unequal right and left sides. B. A frontal or coronal plane. It divides the body or an organ into anterior or front and posterior or back portions. C. Transverse, cross-sectional or horizontal plane. It divides the body or organ into superior or top and inferior bottom portions. Note the above planes, that means the sagittal, frontal, and transverse plane are all at right angles to one another. D. Oblique plane. It passes through the body or organ at an angle between the transverse plane and vertical plane. What is section? When we cut organs through these planes, the resulting flat surfaces is termed as section. Example: transverse plane gives transverse section. It passes through the body or organ at an angle between the transverse plane and vertical plane. What is section? When we cut organs through these planes, the resulting flat surfaces is termed as section. Example: transverse plane gives transverse section. Now I am going to teach you about the axes of movements. The movements of the body are based on three main axes, which are perpendicular to each other. A. Longitudinal or vertical axis runs from the center of the head to the sole of the foot in longitudinal direction. It is perpendicular. To the floor. What movements include in this axis of movements? Medial or internal rotation. Lateral or external rotation. Pronation and supination. Example, pull up. B's sagittal axis runs from anterior to posterior aspect of the body or vice versa. It is parallel to the floor. Movements are abduction and adduction. See, a transverse or horizontal axis runs from right to left or from left to right. It is parallel to the floor. Movements are flexion and extension. Note, circumduction is a movement to take place on all the three axes. Concept of the movements. Flexion indicates bending or decreasing the angle B/in the bones or part of the body. B. Extension indicates straightening or increasing the angle between the bones or part of the body. C.
Thanks for your
Abduction
watching.
means moving away
Don't
from the
forget
median
subscribe,
plane
like, share,
upper
and comment.
and
Have a good
lower
time.
limbs. In the fingers is moving the other finger away from the third digit or middle finger. Moving the other toes away from the second toe. D. Adduction means moving toward the median plane, upper and lower limbs. In finger, moving the other finger toward the median plane of the hand, third finger. Moving the other toes toward the second toe. E. Medial or internal rotation brings the anterior surface of the limb closer to the median plane. F. Lateral or external rotation takes the anterior surface of the limb away from the median plane. G. Circumduction is the circular movement that is a combination of flexion, abduction, extension and adduction and the end of the limb. Describe the circle. H. Opposition is the movement by which the pad of the first digit, thumb, is brought to another digit pad. I. Protrusion is the anterior, forward, movement as occurs in the protruding the mandible. J. Retrusion is the posterior, backward, movement as occurs in retruding the mandible. K. A protraction and retraction is the anteriorly and posteriorly movement of the shoulder. L. Eversion moves the sole of the foot away from the median plane, turning the sole laterally. M. Inversion moves the sole of the foot toward the median plane, facing the sole medially. N. Pronation is the movement of the forearm and hand that rotates the radius medially around its longitudinal axis, so that the palm of the hand faces posteriorly and its dorsum faces anteriorly. O. Supination is the movement of the forearm and hand that rotates the radius laterally around its longitudinal axis, so that the dorsum of the hand faces posteriorly and the palm faces anteriorly.